There have been some new developments and potentially new targets, new agents presented at this meeting that looked pretty appealing. And one was an approach and a trial called Galaxy-1 with a target called the heat shock protein, or HSP90, with a drug called ganetespib. And that was studied in the second-line setting combined with Taxotere, docetaxel, versus Taxotere alone. The study looked pretty encouraging. Tell us a bit about it, Marian. What did you think of? What does it mean? Where's it going?
Yeah, this is a really interesting, this class of drugs I think is very interesting because, now getting into so many of these very specific targeted drugs that just have one target. Heat shock proteins are chaperone proteins, so they help other proteins to sort of survive in the cell. And so they may be a chaperone for many of these proteins that drive cancers. And so there's been some encouraging data in using HSP90 inhibitors in patients who have ALK translocations, for instance. But this study was combining it with chemotherapy compared to chemotherapy alone. The results were quite encouraging. There did appear to be benefit for the patients who were on the ganetespib plus Taxotere arm. And then there was this intriguing finding that the patients who had gone more than 6 months from diagnosis without progressing seemed to have a particular benefit from the drug. And in fact, in the phase 3 trial called Galaxy-2, which is going to test this compound further, the patients are going to be selected by those who have greater than 6 months without progression from the time of diagnosis. The progression-free survival was about 5 months in those patients who were greater than 6 months out compared to 3 with Taxotere alone. And I think it's an interesting study. Will be interesting to look at potentially subgroups who may benefit more. There was quite a bit of controversy in the discussion and in the folks I heard talking around me about using this greater than 6 months as a marker for selection because it's so vague. And we have to think in this era where we're getting so much more sophisticated, isn't there any more specific biomarker we can come up with than that? And even a lot of controversy about, across institutions, just the way you restage patients, how often you do that may affect that, and it seems to be a very imprecise way of selecting patients. But it does look like a promising agent, particularly in that subpopulation.
Importantly, I think that the Taxotere arm didn't do worse than expected, really. No. I mean, it was about what you'd expect to see. It's just that the combination appeared to do quite well. Yeah. It was not a large randomized phase 3 study, but on the other hand, it was a very well-conducted and pretty large phase 2 study that I think left me pretty optimistic that this is something that definitely needs to be tested in a larger setting, and it is, of course, moving forward with Galaxy-2. I think that's something that I will be enthusiastic about, although your point is well taken about restarting the clock 6 months after diagnosis, that the point was made that 40% of patients who we see are not going to get to that point. Right. So you are going to disqualify some patients, and Nate, as you brought up earlier, that Taxotere may be a challenging partner with another drug. And for most of us, we aren't thinking the problem with it is that it's not toxic enough and we need to add something.
Right.
What did you both think of the side effect profile of the combination? Is that going to be a prohibitive challenge in enrolling patients in terms of doctor enthusiasm, or at the end result, especially as it rolls out more broadly than a few centers?
It actually looked pretty good, I thought. I had some exposure to HSP90 inhibitors in the past, and some of them did have a lot of toxicity concerns, particularly eye toxicity, which is not something most patients want to hear about when you're telling them about a drug. And overall, I thought the toxicity of the combination looked good.
Yeah, I think there was more diarrhea, which is something I think all of us are fairly experienced with dealing with. Yeah. And so as long as you're prepared for that and the patient's prepared for it, you can usually deal with it. I agree. I don't think that the increase in toxicity was enough to overcome the promise of the drug.
And you were optimistic. I mean, you felt like it was a...
Absolutely. I mean, there's clearly a signal of activity. I mean, this is an exciting class of drugs. Now, this was limited to the adenocarcinoma patients, and we now know from our molecular testing that the majority of adenocarcinoma patients have some kind of a driver, and many of these are clients of the HSP90 protein, which is being inhibited. So what I really hope we're going to see in this trial is some kind of comprehensive analysis of the tumors so that we can, after the fact, go back and say, not, well, the ones who actually lived longer before we started are the ones who lived longer after we did the trial, but in fact, maybe it was the ones who specifically have something driving their tumor that HSP90 is affecting are the ones that we can benefit the most from this, so that we can actually pick the people who should get it ahead of time or the people who shouldn't get it ahead of time.
And you do make a good point that we should underscore that the study was, I think, initially open to all histologies and then was closed to squamous based on concerns about toxicities that emerged early on and some bleeding complications again,
Right.
and then didn't look like the efficacy was clearly good enough to justify that, so it moved forward with the adeno-only population.